PNG into fasting and prayer. No community transmission. And special flights from mine sites approved.
This is the National EMTV News with Helen Sayer.
Good evening and thanks for joining us for Wednesday's news. Prime Minister James Marape, wife Rachel and other dignitaries attended the fasting and prayer day at the 6 Mile Tabernacle of Prayer Church this morning. The less than 100 crowd included guests and leaders from the mainline churches. The Prime Minister also launched and dedicated today as the first day of prayer and fasting against the coronavirus pandemic.
The National Prayer and Fasting Day began with invited guests filing into the church while maintaining social distancing, fist or elbow bumping as precautionary measures to the coronavirus outbreak. Leading the way was Prime Minister James Marape and wife Rachel. This morning's service was attended by selected church leaders from the 7 mainland churches, parliamentarians and invited guests. PM Marbella says these 21 days of prayer and fasting should be a time of giving our lives to God and thanking Him for His abundant blessings.
God has given us this opportunity for us to step down and relook at ourselves. Every one of us, from myself as Prime Minister down to every citizen, once we've really taken stock of ourselves, then you can know how you could contribute to your country, contribute to your workplace, contribute to your family and yourself, and more importantly, contribute to God by securing your life for eternity.
Papua New Guinea is very fortunate not to have local transmissions of the deadly coronavirus at this stage. Marbella says the country should uphold its stand as a true Christian country.
So today me come here and talk about me, Prime Minister, try best, but so far you mean what corona yet, me making, government making, God making. Yeah. Doesn't matter how many come out, police come out, walkman, health come out, plant your health come. Now people walk today is not. That's what God making, they missed up safely. Yeah. So you will come today. All pastors who are here, all pastors who said you have the church members, number one, you will thank you, Lord God, Lord Holy Mimi come coming up now.
Scriptural explanations of prayer and fasting was done by Reverend Joseph Walters. Reverend Walters urged every pastor, priest and Christian to pray for the country during this time of chaos and uncertainty.
God will not come and interfere and intervene unless we invite Him. And so when a government, through its leader, the Prime Minister, invites God, we are saying, God, be legal in Papua New Guinea. We give you the legal right and permission to interfere and interact with us and help us in our time of need, in time of danger.
Today, my fasting begins. This is what the Prime Minister said as he walked out of the 6 Mile Tabernacle Prayer Church with wife Rachel Marape. Michelle Stephen, National EMTV News.
The Independent Consumer and Competition Commission will be assisted by police to effect the arrests of business houses purposely increasing prices of goods and services. Commissioner Paulus Ayn says the watchdog has received reports and enforcement teams have been tasked to crack down on the offenders. Commissioner Ayn said a survey shows most suppliers have enough stock during the state of emergency and consumers should not be panic buying.
With the state of
an economic package that should lift the burden.
With the state of emergency announced by the government, basic goods have also been declared not to see a price hike. These include rice, flour, sugar, soap, fuel, household batteries and sanitizers, bottled water, tin food, noodles and biscuits, among others. The ICCC Commissioner says business houses should not take advantage of the 14-day lockdown.
In the process of undertaking this exercise, we are appealing to the business houses to strictly comply with the declaration that you should not be excessively increasing the prices of goods and services that are now declared under the current emergency.
ICCC will now be working with police to make arrest of supervisors or management of business houses who are purposely changing prices of these basic goods. If prosecuted, a fine of 50,000 to 100,000 or a jail term up to 6 months or 2 years in prison. Consumers have also been urged to report shops that are inflating prices.
So if you see an increase that's very much inflated, either you take a photograph of the item with the price next to it, or you purchase the actual product and you present us with a receipt, okay? So that way we have evidence and it's easier for us to prosecute or to go after the offenders.
The watchdog has received complaints from consumers and have contacted the relevant shops named. While there is a 5% ceiling of the increase in basic goods, Commissioner Aine is urging consumers not to panic buy. ICCC's dialogue with major suppliers has assured that there is enough stock for the 14-day lockdown.
There should not be any panic. The consumers should now be relaxed. They should not spend all your money one go, so that the shoppers and the managers take advantage of this situation by escalating the price. Supply is okay, price control. We are having our enforcement team on the ground. Those non-compliant, according to this gazette, we will have them arrested.
Jagla Power Jr. National EMTV News.
Frustration boiled over this morning when a handful of residents in Port Moresby's Baroko East took to the streets outside the Rita Flynn netball courts, disrupting the setting up of what is supposed to become a COVID-19 testing and quarantine facility. They bluntly refused to accept the setting up of the facility, saying it poses a health threat to their families residing in the area. Residents mobilized and attempted to fight their way in, only going as far as knocking down the outside barricade before police reinforcements were alerted and dispersed the crowd. No casualties have been reported. Employees of ExxonMobil at the PNG LNG site in Hela and Leher gold mine in New Ireland have received special permission to be airlifted out of the mine and gas sites. Police Minister Brian Kramer said the exception was approved on grounds that the chance of shift for these employees was nearing and that mining companies hold high safety and healthy policies. Meanwhile, as efforts against COVID-19 are implemented, a Qantas flight en route to Jackson's International Airport yesterday that was supposed to fly in empty and pick up passengers was ordered not to enter PNG as there were passengers on board, mostly Papua New Guineans.
From WHO.
While the government has announced a lockdown on all domestic and international flights, it is giving exceptions to flights carrying essential cargoes like personal preventive equipment, medical drugs and other essentials. After concerns were raised on the chartered flights carrying mainly expatriate employees into Port Moresby from Hydes and New Ireland, the police minister explained their request to leave the sites were granted by the health minister, Jelta Wong.
So yesterday we cleared a flight for Lihia to transport their staff off shift. Now, why we are giving exceptions to them? For the simple fact, mining companies and oil and gas have the highest health and safety policy. And one prime example of that is that the confirmed case that went to a mining site, as soon as he was demonstrating symptoms of COVID-19, they locked him down. If this was a Papua New Guinean or an everyday Papua New Guinean who had COVID-19, he would be engaging in markets, supermarkets, family, and this would have spread. So in those cases of mining companies, because that's an important economic sector for Papua New Guinea, the government, because that's where we get our revenue for. So we are making every provision and assistance to ensure our mines, mining company, oil and gas continue to operate.
At this point, mine workers and those who are on the fly-in, fly-out arrangements are persons of interest in relation to the transmission of COVID-19. Last Tuesday, when the announcement of the first probable case was announced in Papua New Guinea by the health minister, mining houses were the first to scale down on operations, advised its employees to work from home and set up quarantine facilities. Of the 32 samples that were sent to the Institute of Medical Research for testing, Most of them were from the mining sites.
So in those cases, there was a written request that came through to the health minister. He signed off in it, and they were able to move their Papua New Guinea employees back to their respective province coming off their shift. So the specific one you mentioned, I haven't been aware. We've already, I think this morning, if it was Exxon, I think they sent through a pass, and a response letter was sent back this morning, giving them approval to move their staff, but we are documenting all of their staff. And so in the event that there is a case, we will be able to pinpoint where they are. And again, they are told to go home and stay home. If it's expatriates, they're coming to Port Moresby and they are departing Papua New Guinea.
Meanwhile, more emphasis is given to the traveling public to minimize travel from one province to the other. At the press conference at 9 a.m. this morning, Minister Wong, when asked on the implementation of the containment plan, said the National Task Force team is working on implementing an emergency strategy plan.
COVID-19 has come into our country and has given us time to see what our health systems take stock of, our preparedness and everything. So at the same time we are combating COVID-19, we have a team that is writing up our emergency strategic plans, what to do in the future.
Tekla Gunga, National EMTV News.
The PNG Nurses Association today laid demands on the government to adhere to their petition. Association President Frederick Kabai says in relation to the 14-day lockdown, no specific directives have been given for essential services. The association has petitioned the government to look into their welfare as they feel they would be targeted to handle COVID-19 patients should there be an outbreak. If no response is given in the next 24 hours, all nurses nationwide plan to go on strike.
Nurses in the nation's capital gathered in numbers today to petition the government. PNG Nurses Association President Frederick Kabai says they want specific instructions from the government and how they would be looked after in terms of welfare.
We're hearing some very good news from the government, but at the clinical setting, we are not seeing any impact at the clinical service in terms of personal protective equipment. Since there is a lockdown at the moment, transport are also been locked down. Stores are being also closed. How is the government going to look after us within these 14 days? These are things that we want to hear from the government.
In every hospital around the world, nurses and health workers are the first point of contact in the case that PNG should have COVID-19 patients. The country's nurses are frontline health workers who will be exposed. However, to date, Port Moresby General Hospital has no personal protective equipment. They only have gloves, no head mask, no gown, no boots. The nurses' question now is, what is the government's plan on protecting the nurses?
First one is education and training, that we would like it to be happening at a clinical setting after the nurses in their operations in terms of the incentives and resources, logistics, and many, many more things. Funding must be readily available so that it can be accessed and can be pumped straight into the fight against COVID virus.
The Nurses Association has already given a petition to the government, however, have not received any response. They are now calling again on the Prime Minister and Health Minister for a reply to their petition, or they will go on strike. Lilian Sopera Kenea, National EMTV News.
50,000 face masks and 15 non-contact infrared thermometers were donated to the National Health Department today by PNG Ports. Of the 50,000 face masks, 5,000 masks along with the 15 non-contact infrared thermometers will be given to RPNGC for police enforcing state of emergency measures. Health Minister Jelta Wong thanked PNG Ports for the donations and assistance for the fight against COVID-19. Deputy Police Commissioner for Operations Operations, Donald Yamasombi, said 1,000 masks will be given to police here in NCD.
Face mask and 15 of these thermometers to use around the country. Thank you very much. And some of them will be providing to the Royal Papua New Guinea Constabulary so that they can use it on roadblocks and checks around the city and in other parts of our country.
One carton has been given to us. It has about 5,000 in there. And I think I'm giving 1,000 now to NCD Commander. That will be distributed between NCD and Central Province right away. The rest, some will be used by our people at police headquarters who are also deploying with NCD. And the remaining, I'm looking at sending them out to wherever it is most needed. I understand, I think they've got some donations given to them, but if they really need, we will definitely get some out to them. It's 5,000, 1,000 here, the other 4,000 will be shipped out.
You're watching National EMTV News. We'll take a short break. Coming up next, Head of Reproductive Health Dr. Glenn Moller gives his views on the deadly virus and testing for COVID-19. Stay with us. Welcome back. There have been rumors circulating about Papua New Guineans having immunity to the COVID-19 virus. There are some who say this is the reason the country is not yet in a frenzy with the virus. However, Dr. Glenn Moller has clarified to EMTV News that it is just fake news and the country needs to take preventative measures to protect ourselves.
Head of Reproductive Health for School of Medicine and Health Sciences, Dr. Glenn Moller, has come out on social media stating that no one is immune to the coronavirus. He spoke to MTV News today and stated that the talk of Papua New Guineans being immune to the virus is fake news.
The way you get immunity to a infection is either your ancestors have had it for many thousands of years, and so you're born with some small amount of innate immunity, or you have personal experience of the infection and your body responds with an immune response to the infection. They're the only.
Dr. Moller says COVID-19 came from animals and knows how to live in harmony with them.
This particular coronavirus has been living in harmony with bats and pangolins and for probably 1 million years or something. Viruses like, well, everything living likes to survive. We all try to survive. And so you're killing all the pangolins, so there are no more pangolins for the virus to live in harmony with. So they're looking for another species. And so they go into the humans, they can't infect the humans, but then one of them mutates.
According to Dr. Moller, getting the virus can be a good thing.
This virus, there's no effective antibiotic or antiviral yet.
He also advised that if you are sick, stay home and do not plan a pregnancy for this year. And also do not self-medicate yourself.
So all this la pigin ini, a good plan long kisim coronavirus time epidemic can because boli got immunity now. And then time boli go big pla long next generation and boli got immunity now. But nice, yeah.
Lilian Sopera Kenea, National EMTV News.
The PNG government has requested 10,000 testing kits from Australia to help minimize a possible spread of COVID-19. Police Minister Brian Kramer revealed this when giving an update on the government's position in efforts to contain the virus.
Call for this on call 20.
Last Friday, PNG reported its first positive COVID-19 case in Marbella. However, the person who was tested positive was airlifted out of Papua New Guinea on Monday. So far, PNG has not reported a locally transmitted COVID-19 case, but the government is yet to announce results of the 13 of the 32 samples that were sent to the Institute of Medical Research for testing.
84 passengers or 84 people traveled on the Singapore flight. There were 77 passengers, 7 crew. So most of them have been tracked down, and all of them have indicated that they did not have flu symptoms, and they are being monitored. Now, past the 14-day, there are procedures and practice in place. Even to the 21-day, they will be checked again. Now, so God willing, that in the next, by now to Friday, that there was no transmission from that confirmed patient to anyone else. Now, it's important that Papua New Guineans understand that the only way you will catch COVID-19 is through saliva or droplets.
On the issue of contact tracing on the 84 passengers who travelled with this subject from Singapore into Port Moresby and the flight to Lae, the government is still working on contacting those passengers. Meanwhile, as provincial task force teams are set up to lead the fight against the coronavirus in the province, the PNG government has requested for 10,000 testing kits from Australia. Minister Kramer says only people who show severe symptoms of flu will be tested due to the limited number of kits we have in the country.
So we will find out, I guess, in the next 24 hours what the percentage that the Australian government can provide. We've made a formal request for 10,000, and hopefully they will come in the country in the next 24 to 48 hours. But again, testing isn't the critical issue now, is to be able to track down those at a high risk and also obviously maintain the lines so Papua New Guineans, the public can call in and the rapid response team can go down.
Stakla Gunga, National EMTV News.
The Marbella Provincial Health Authority has ordered 30,000 rapid test kits which are due to arrive soon. They have also ordered 3,000 litres of hand sanitizers from Beltec in Port Moresby. Discussions have also begun with Ramu Agri Industries to look at the possibility of using locally produced ethanol to make hand sanitizers. This will be used to support ongoing efforts to increase the state of readiness. Marbella will have more than 60 beds ready for its provincial response. National Planning Minister Sam Bassel said his department is ready to support COVID-19 efforts in the country by sacrificing public investment program funds to keep essential services going. This is if the situation worsens and the country is put under a complete lockdown.
Make sure that we stand by to assist the national government in terms of sacrificing some of the PIP programs and projects to make sure that we ensure that essentials such as the power, water, garbage collection, the law and order issues, Air New Guinea, the ports, that we need supplies of goods and services that we need from overseas must continue to operate should PNG comes down to a lockdown situation.
And now looking at the NASFund market reports, the Kina opened unchanged at $0.292 in the interbank market. At Bank South Pacific, your Kina was buying $0.2845, $0.4731 Australian dollars, $0.2557 euro and 31 Japanese yen. Looking at commodity prices at New York close, gold is trading higher, coffee, cocoa and copper closed higher. Palm oil and copper closed lower, while crude oil is trading higher. And on the stock market, the Dow Jones closed at 2,112.9 points higher. The ASX is trading at 262.41 points higher. And the All Ordinaries is trading at 252.88 points higher. National EMTV News continues with more after these messages. Stay with us. Welcome back to the news. Turning overseas, in New Zealand, a state of emergency has been declared, giving the government special powers to combat the spread of COVID-19. 50 new cases have been confirmed today, bringing the total to 205.
A country shutting up shop today as New Zealand heads into an historic lockdown.
Breaking the rules could kill someone close to you. And that is why it is so important.
Parliament sitting for the last time, declaring a national state of emergency.
We have a window of opportunity to stay home, break the chain of transmission and save lives.
It's only the second time in New Zealand's history such a call has been made, the last following the Christchurch earthquakes.
As this Parliament ceases to sit for at least a month, we will join with the government.
From today, Civil Defence will pick up extra powers, allowing, if necessary, for the conservation of food, fuel and other essentials, closing roads and public places, as well as a ban on people or vehicles from any area.
We don't want thousands of people to die. It is that plain and simple.
A tougher stance too at New Zealand's borders.
Every New Zealander coming through our borders will be screened. If they are symptomatic, they will be tested.
Those who are symptomatic or lack approved accommodation or travel plans will be forced into a 2-week quarantine.
If they are not following requirements, they will be fined and they will be quarantined.
As for those who are permitted to isolate privately, a warning from the Prime Minister.
These measures are tough, but reflect the higher risk these New Zealanders pose.
Tough new approaches as the country prepares for the tough road ahead.
The U.S. state of Washington was the first to see a major outbreak of the coronavirus in the U.S. It swept through a nursing home. The healthcare workers there have told their story.
It was like a war zone. So all of a sudden there were so many patients. Everybody needed medications. Everybody needed treatment.
We had 70 staff within a week that were out.
These healthcare workers were among the first to battle a COVID-19 outbreak in America. Few in the United States have more experience with the deadly toll it took.
How quickly do you see the demise of someone with COVID-19?
Less than 24 hours.
They work at Life Care Center of Kirkland, the nursing home where the first known U.S. cluster of COVID-19 deaths and infections occurred. For a month, they have been treating and continue to treat coronavirus-infected patients.
Have any of you had symptoms of the novel coronavirus?
No.
Have any of you tested positive for COVID-19?
For weeks, this was the location of the most deaths from the novel coronavirus in the United States. This is the first time their story of what happened inside has been told.
If you Google signs and symptoms of coronavirus, it's runny nose, fever, and cough. I haven't seen a runny nose yet. What I see is much different than that. I saw what I describe as red eyes.
I'd never heard of red eyes before. Why is that? Is that information just not gotten out to the public?
It's something that I witnessed in all of them. They have like, you can describe it like allergy eyes. The white part of your eye is not red. It's more like they have red eyeshadow on the outside of their eyes. But we've had patients that just had the red eyes as the only symptom that we saw and go to the hospital and pass away in the hospital.
As of now, the CDC does not list red eyes as a symptom of COVID-19. Chelsea Ernest is a registered nurse and the nursing director at another Life Care Center facility in Washington State, and that is what she saw. When an urgent call for help came from the Kirkland facility, she volunteered. She arrived one day after the staff learned a patient tested positive for coronavirus.
Why did you answer the call? You didn't have to be there. This was voluntary.
Well, I'm a nurse, and they're not my patients, but hold on, I'm sorry.
It's okay, take a breath.
Ernest and her fellow staff members saw the death toll rise like a rocket. The terrifyingly fast deterioration of the patients always seemed to happen on the night shift, her shift.
That's how I describe it, is you're going off to war and you're in a battlefield where supplies are limited. The help is slow to get to you. And there's lots of casualties.
And you can't see the enemy.
And you can't see the enemy.
Suddenly, a third of the staff had symptoms and was out sick. Before they all knew it, the virus was sweeping through the entire building. It was the oldest patients who were dying fast. In those first few days, the Life Care Center said they made a cry for help to government agencies from county to federal to state.
Did you get what you need when you needed it?
No.
No one was doing just one job. Stephanie Booth is in charge of payroll.
I worked in the kitchen. I don't know, I've done a little bit of everything. I did some housekeeping.
Everyone was doing everything until doctors and nurses arrived from the Centers for Disease Control and Prevention and Health and Human Services. The number of patients in the facility has dropped now from 120 to 42. Of those 42 patients, 31 have tested positive for novel coronavirus.
What advice would you give other facilities, other doctors and nurses, other staff members about dealing with COVID-19?
I didn't expect it to be so lethal. And I have no shame in saying that I was wrong.
Nurse Chelsea Ernest says she was wrong about thinking that the coronavirus was just a bit worse than the flu. She does not think that anymore. And while the staff says they did make some mistakes, this was the first place in the United States to try and deal with a brand new virus.
And back home now, 38 samples sent to the Institute of Medical Research for COVID-19 have returned negative. Of the 38, 10 samples are from employees of Hidden Valley who had come in contact with the positive case. Police Minister Brian Kramer said contact tracing is being done and those that were on the flight from Singapore to PNG will be tested. Currently, there are 1,000 test kits in the country and 5,000 more expected to arrive in the country tomorrow.
To go facility that's based.
The Police Minister Brian Kramer confirming that as of yet there has been no community transmission.
COVID-19 update from NOC 19. Again, as of 4:00 p.m. this afternoon, there is no confirmed case of coronavirus in Papua New Guinea.
PNG IMR releasing a media statement explaining that of the 38 test samples, of which 10 are collected from the Hidden Valley employees who had made contact with the positive case, are negative. Today, 16 samples from Hidden Valley employees who had come in contact with the positive case were sent again to PNG IMR for testing as the 14 incubation period comes to an end.
Those samples have landed in Goroka, and we've asked for IMR to give it priority, and we should get test results by tomorrow lunchtime.
World Health Organization Team Coordinator on Outbreaks and Health Emergencies for PNG, also clearly stating why PNG IMR is WHO accredited and why initial test of positive case had to be sent to Melbourne, stating it is part of WHO procedures to follow for the first lot of positive tests.
So that's why IMR is accredited by WHO in terms of testing we call influenza. So this is testing of influenza, the procedure more or less this similar to what was used to test COVID-19. Laboratory in Melbourne we call Vigro to reconfirm. This is a routine, not because the Institute of Medical Research is not being trusted as a routine.
WHO also explained that testing should be done only if a person is showing symptoms. His comments adding on to PNG IMR's statements, which also asked the public to practice social distancing, regular hand washing and disinfecting of commonly touched areas.
Samples, you take some based on they should be a patient. Patient means have symptom signs. Yeah, if anyone have no symptom signs, he may not become a patient.
For PNG, test kits will become priority if there is a local transmission. Police Minister Brian Kramer saying that currently there are 1,000 test kits in country and a further 5,000 are arriving in country tomorrow.
And so even trying to secure test kits around the globe is becoming extremely challenging. So the 5,000 hopefully by tomorrow again will be put on a flight out of New Zealand and we'll be able to upload it to PNG.
While the positive case has left PNG shores, the search still continues if the positive case had transmitted the virus. Contact tracing has been ongoing on passengers on the Singapore flight to PNG and Leigh Hoskins flight.
Part of the process has now been effected with
not only ourselves, but migration as well as New Guinea, and all the key players that have been in the whole process of this index case. And that we have got the number of the passengers, and we are going one by one as we go through the whole process, what's happened and linking up. And some of those we have contacts, some of those we don't have, but the process is being effected to ensure that we get through to each and every single one of those people.
Police Minister Brian Kramer stating if there is a community transmission, the isolation area may be at Bomana Immigration Centre that was set up by the Australian government as a holding facility for refugees here in Port Moresby.
We have a ready-to-go facility that's basically built by the Australian government for the purposes of holding refugees as a transit centre. So I visited that facility in the last hour with WHO officers and waiting on their recommendation. At this stage, it looks like it's the ideal location. There's 59 rooms. It houses 122 people. It has self-contained generator, water, mess facilities. It has some of those units have aircon. So we couldn't find the better facility, but it's not for me to declare that is the facility yet because we just inspected it. WHO now will make that recommendation to the Health Department, and then we will take over that facility.
Adelaide Sirks, Kari National, EMTV News.
A medical team from Lae travelled to the Hidden Valley mine site today to gather test samples from the 16 patients who are currently being isolated on site. These 16 patients came into contact with the person who was confirmed as the country's first imported case of the virus. They have been kept in isolation since being identified. Samples sought from these suspected cases will be tested at the Institute of Medical Research. Up next, some sporting updates in Chukai Sports. Stay with us.
Chukai Sports.
Welcome to Chukai Sports. For the first time in its modern history, the Olympic Games have been postponed. Japan and the sporting world are facing a nightmare.
Sport's greatest global showpiece succumbing to COVID-19.
We have to postpone the Olympic and Paralympic Games, Tokyo 2020.
An announcement that seemed inevitable, yet still shocking. The Games have only ever been cancelled during World War I and II, never postponed in peacetime. But pressure's been ramping up. Just yesterday, New Zealand joining a growing chorus of nations calling for the move.
The IOC was really looking incredibly hopeful, almost to the extent of being naive.
To give you an idea of how much money is at play here, organisers last year estimated the Games would cost them around 20 billion New Zealand dollars, though some reports say that number could be even higher. It also doesn't take into account other spending like domestic sponsorship, which totals more than $5 billion. Thomas Bach today saying the cost of postponement wasn't discussed, but it's likely to be huge. Early reports suggest Japan could be looking at about a $10 billion economic loss. The money one part, the huge logistical challenge another. Organisers now dealing with rejigging everything from venue availability to commercial contracts.
They have also assured us that it won't be a compromised Games, that it'll be complete.
For athletes, they're often carefully planned four-year build-up out the window.
We all want to see the Olympic flame at the end of this dark tunnel.
A flame staying in Japan, a symbol of hope, even as this year's Olympics dreams were extinguished.
And although, like so many situations at the moment, the postponement leaves more questions than answers.
Surely no gold medal was ever won without a bit of struggle.
What can we do as an athlete?
you control the controllables, and this is well outside the scope of any athlete's control. So you just get on with the task at hand with the information that you have.
Today's announcement postponing the Games, something Bond and fellow elite athletes believe is the right thing to do.
A cancellation would have been devastating, but we've still got an Olympic Games to look forward to. And I guess the relief comes from the fact that all of the uncertainty has been taken out of the equation, and now we can focus on what's really important right now.
Now gearing up for a winter of training, isolated at home.
So this is the pièce de résistance. We've got an erg here.
Luckily for the New Zealand rowers, High Performance Sport and Rowing NZ have kitted out their homes with training equipment. The announcement has come as a relief for some. Eliza McCartney had been battling injury and was in a race against time to qualify.
It was always going to be a challenge for me to qualify for an Olympics in July this year, but I was ready for that challenge, and I'd been prepared for it for the last 6 months, and that provides a lot of motivation as well.
One News sought reaction from two of our most successful Olympians, Dame Valerie Adams and Mahé Drysdale, to see whether they'll push on for the next year. Both have been unavailable for comment.
Some will be very disappointed because they were aiming to be at their pinnacle in July and August 2020, not 21. So there's a whole range, a diverse, sense of feeling amongst the athlete community.
But there are assurances it won't be a compromised Games. Japan will be staging the real thing, and by July 2021, everyone will be on a level playing field. Officials have confirmed next year's Olympics will still be named Tokyo 2020. That'll come as a saving grace for organisers, meaning merchandise like this can still be sold. As well as Japan, our national athletes will be preparing for a new date, with those who have already qualified for Tokyo set to get the nod automatically.
Chukai Sports continues with more after these messages.
Chukai Sports.
Welcome back to Chukai Sports. For New Zealand weightlifting star David Letty, this is the perfect time to be boarding with his coach. The pair has gone into lockdown together, devising a new plan, having already qualified for the now postponed Olympic Games.
If you see this man and his weights on the streets of Te Kaupata, south of Auckland, make sure to wave out. Like many Commonwealth Games gold medalist, David Letty is now trying home workouts.
I had my first session this morning. And so we've got some weights in the squat rack and some bars.
It's equipment he and coach Tina Ball brought down from their gym in Auckland last night. They needed to keep training, having qualified for the Olympics, only to hear this morning it had been postponed.
As much as I knew it was coming, I was still sad. Because I guess for us it's been that anchor, something that we've been driving for a long time now.
David lives with Tina, who filmed the footage for this story on her phone. She keeps him focused on training, especially now he can't see his parents, who are in Tonga behind closed borders.
No different than normal, except making sure that he gets out of bed to train, like he's a big sleeping bear sometimes.
When she needs me to do the lawn, she'll tell me. Because one of her sons comes and takes the lawnmower, and so we have to wait for ages.
I keep saying rest and recovery is important, so he certainly listens to me on that score.
I need my rest, so...
Probably dreaming of the day things go back to normal. For now, we'll all have to crack on using what we have.
And that ends Chukai Sports. The weather details coming up next.
Chukai Sports. Chukai Sports.
This weather update is proudly brought to you by Money Plus. With you always.
A look at the weather forecast for tonight and tomorrow. Cloudy with a few showers and possible thunderstorms in Port Moresby, Daru and Kerema. Cloudy with a few showers in Alotau and Popondetta. In the Mamasa region, cloudy with a chance of a shower or two in Leh and Medang, Vanimo included. In Wewak, a shower or two. In the New Guinea Islands region, thundery showers in Lorengau, Kavieng and Kimbe, cloudy with rain showers in Kokopo, Rabaul and Buka. And in the Highlands region, cloudy with a chance of rain showers right across the region in Mount Hagen, Goroka, Kondiawa, Mendi and Wabeg.
The weather update was proudly brought to you by Money Plus, with you always.
And that's been the news, sport and weather for today, Wednesday, 25th of March 2020. On behalf of the entire EMTV News team, pleasant viewing. Good night.